Hello, everyone. My name is Brendan Concannon, aka Master of Rehabilitation Science. Welcome to the Standardized Mini Mental State Examination Guide. Disclaimer: this is not a full demonstration of the assessment. Not every question on the assessment will be covered. You are expected to thoroughly read over all materials before performing the assessment. This guide contains the following contents. Part 1. What is the Standardized Mini Mental State Examination? Part 2. How is the assessment performed? Part 3. How do you score the assessment? What do the scores mean? Part 1. What is the Standardized Mini Mental State Examination, or MMSE for short? It was developed by Marshall and Susan Folstein in 1975. There was a need for a standardized, simple, and reliable tool to assess cognitive function. Thus, the Standardized Mini Mental State Examination, or MMSE, was created. The MMSE is one of the most widely used assessments for determining a person's cognitive functioning. It is often cited in research reports that determine if people's cognitive function changed over time or if a new treatment protocol was successful. The MMSE assesses several cognitive functions, but the most notable are short and long-term memory, spatial memory and orientation, attention, and language. The MMSE gives a score between 0 to 30, with lower scores being associated with cognitive impairment. It is only one of the investigations performed to assist in establishing a cognitive diagnosis. The MMSE should not be used to provide a diagnosis by itself. Other assessments and expert opinions must be considered. Main strengths. It can be performed in 5 to 10 minutes with simple equipment. It provides objective measures of cognitive functioning, widely accepted by researchers and clinicians. The main limitations, however, is that it is suspect to language, educational history, and cultural bias. Sensory deficits, such as blindness and deafness, may impact the validity of the score. Part 2. How is the assessment performed? Disclaimer: this is not a full demonstration of the assessment. This guide will not cover every item on the assessment, and you are expected to thoroughly read over the materials before performing the assessment. Preparation. The following items are necessary to perform the MMSE: a wristwatch, a pencil, an eraser, a blank sheet of paper, close your eyes written on a sheet of paper, and 2 pentagons, 5-sided shapes, drawn on a sheet of paper, which are slightly overlapping to create a 4-sided shape in the center. Of course, a copy of the Mini Mental State Examination itself is recommended. It is a good idea to read the beginning portion of the MMSE, as it may provide information for setup. Key points include ensuring hearing and visual aids are available and in good working order. Check that the location has good lighting and ventilation. Make sure the location itself does not contain clues for answering the questions like calendars, newspapers, maps, etc. Introduction. Greet the client and introduce yourself. Ask for the client's name. This builds confidence and verifies that they can hear you. Record the client's name and current date at this point. Request permission to run the questionnaire with the client. Ask, would it be all right to ask you some questions about your memory? It is recommended to avoid the term memory test. Key rules. Throughout the assessment, it is important to remember the following. Instruct anyone else in the room to allow the client to speak for themselves only. Ask the same question or repeat its instructions up to a maximum of 3 times. If the client does not respond after the 3rd attempt, score 0 for that question and move to the next. If the client attempts to change the subject, reply with, "We can talk about that after the session. Let us proceed with the next question." Sample questions. Question 7. Show a pencil. Ask, "What is this called?" Score 1 point for the correct response, except pencil only. Score 0 if the answer is pen. You allow 10 seconds for a reply. This question is worth 1 point. Note that some versions of the MMSE will provide cues to say or ask something, a time limit for how long the client has to answer the question, and a scoring system. Here is another sample question. You ask, "What is today's date?" You accept previous or next date and allow 10 seconds for a reply. This question is worth 1 point. Note that some questions allow for alternative answers, but only when indicated. Most questions are worth 1 point and accept only one exact answer. Important tips. Remember to record the client's name and date when the assessment takes place. Read the questionnaire from beginning to end. It is recommended to record the client's response for each question, especially those that resulted in a loss of points. Make notes of any factors that may have influenced the assessment's validity. And now for some do nots. Do not provide hints or prompts for an answer. Do not respond to answers with nonverbal cues, such as head shaking, frowning, or nodding. Do not respond to answers with words like "that's correct" or "incorrect." Do not indicate surprise, disdain, or disappointment to answers. Do not skip sections, improvise words, or replace objects, such as using a pen instead of a pencil for question 7. Do not give half points for incomplete or near-miss answers. Do not forget to record how the client performed the task, especially when they are incorrect. Do not continue the assessment if the client is feeling pain, drowsy, or physically unwell. Part 3. How do you score the assessment? Scoring. For the most part, the MMSE has a straightforward scoring process. However, there is one question that is controversial. The sample question is question 4. Spell the word world. You may help the client to spell the word correctly. Then you say, "Now spell it backwards, please." You allow 30 seconds. If the subject cannot spell world, even with assistance, you score 0. This question is worth 5 points. Scoring for the world question officially looks like this. First, you write down the subject's response and record the highest number of letters that are in correct relative order for the word world when spelled backwards. You give credit for the subject's self-corrections. If the subject says only one letter, score 1 if it is a D, score 0 otherwise. You subtract 1 point if there are more than 5 letters. If the subject repeats world or part of it in the forward direction, you score 0. If the lowest score is 0, you do not give negative scores as a result of saying too many letters. Scoring for the world question can also be done with the line matching method. It looks something like this. Basically, you write the correct answer above the client's response. You draw lines matching the same letters. If the client provides an impartial answer or the order is incorrect, it would be scored like this. You write the correct answer above the client's response. You draw lines matching the same letters. The maximum score is based on the number of lines that can be drawn without crossing any. Here is another example. If the client repeats world or the majority of the word is in the forward direction, score 0. Unnecessarily repeated letters should not count. A client who says 6 or more letters should lose 1 point from the score, no negatives. If only one letter is said, repeated, or by itself, score 1 if it's a D. Otherwise, score 0. What do the scores actually mean? The following scores represent their associated levels of cognitive functioning. Scores of 24 or higher are associated with normal cognitive functioning. However, scores of 23 or less are associated with mild to severe cognitive impairment. Scores do not relate directly to the functional abilities of the person. People who score less than 20 may have difficulties with the following: managing finances, driving, shopping, cooking meals, managing medications. However, they might be able to maintain their hygiene, eat meals, and dress themselves accordingly. Some symptoms of cognitive disabilities may manifest during the MMSE itself. For example, clients with symptoms of dementia may not complain of memory difficulties. They may insist on trying to get the right answer and be unconcerned about incorrect answers. Clients with symptoms of Alzheimer's may show short-term memory difficulties, followed by disorientation to time and place, and perhaps language deficits, such as being unable to pronounce nouns. Clients with symptoms of delirium may show clouding of consciousness that impairs their concentration, leading to frustration. Their lack of attention may compromise the assessment. Visual hallucinations may occur. Fluctuating levels of alertness may occur. Clients with symptoms of depression may not display obvious short-term memory loss, and they may take longer to respond to questions. They may either show concern for incorrect answers or give up on the task. In conclusion, the MMSE is a well-established, fast, and reliable assessment of cognitive functioning. Attention to preparation and guidelines for scoring can greatly enhance the usefulness of the results. The MMSE can provide information that is useful when planning care for a client. Thank you for viewing this presentation.